So today is all about bringing colleagues from across the health and social care from across the north of England together to talk about frailty. There's 1.8 million people over 65 who have some form of frailty. And if you're over 65, then every year 1 in 3 people of that age category will have a fall of some kind.
Frailty is a really useful concept because it helps us to identify a group of older people who have got reduced resilience and increased vulnerability, and so they're more at risk of having adverse outcomes, and so we can help to understand who those people are and how we can better support them and how we can enable our families and carers and communities to support people as well. So what we're trying to do is we're trying to establish a framework, if you like, and a model for understanding frailty and the needs of people who are living with frailty. And one of the key sort of approaches there is to think about frailty as a long-term condition. We can try and minimise the impact that it has upon them and help them to live much healthier and more active lives.
It's great having events like this, it's great bringing people together, and there's been so much excitement and enthusiasm and conversation in the room. Crucially is, how do you bottle the energy from the room, and how do you give people the ability to go back to their day jobs and not lose that enthusiasm and energy to make changes and to implement some of the great practice that they've heard of that's happening in different pockets of the north of England.
So deprescribing is about exploring the medications that a patient is on, whether it's still necessary for them to be taking that medication, and through guided conversations exploring how maybe they could be taken off their repeat prescriptions.
So Escape Pain, it stands for enabling self-care and coping with arthritic pain through exercise. So it looks very much at education for the participants, also giving people strategies to cope and manage with their own pain and their own condition, and there's also an exercise element to it. So the unique nature of it is combining those 3 elements into quite a structured programme. Escape Pain is aimed at people who have chronic joint pain, generally due to osteoarthritis, and there's some really strong links between osteoarthritis, the pain associated with osteoarthritis, and frailty.
We're at this Northern Frailty event today from a fire and rescue service perspective because we've seen all too often the disastrous consequences fires can have to people in the home. Frailty for us causes a challenge in the local area, so by working together with our health colleagues, with our health partners, we can make sure that our services are delivered to the right people in the right place and at the right time.
We need to develop a Frailty Charter which sets out common standards so that we can identify where practice can be improved across the patch.
I've met lots of people who are doing some great work, fantastic speakers this morning, some really inspirational speakers, so I've got a long list of things to follow up.